today's topic is important topic, and it is indeed one of the very common cause of mortality in the world, and this is ST elevation MI. One of the ischemic heart disease, or we can say one of the uh, acute coronary syndrome. So, ST elevation MI, we all know, is due to the atheromatous plaque rupture, that there is a sudden blockage of the epicardial vessels leading to ST elevation MI or a transmural MI. So, first, let's start with the clinical features. So, clinical features starting with the symptoms. So the most common symptom of the ST elevation MI is of course chest pain, and the origin of this chest pain is it is originated from origin. It is from the nerve endings in ischemic tissue or ischemic myocardium, in the ischemic myocardium, and not necrotic myocardium. So what does this mean as a for management point of view? That if a patient has ongoing ischemic pain or chest pain, it means it is still a viable tissue, it is a ischemic tissue. Once it become necrotic, pain will subside. So very important implication in the treatment. Looking at the description of this pain, the site of the pain, the most common site is retrosternal, and very important point is on the radiation. It is mainly radiate to left arm and forearm. Why? Aggravating factors for ST elevation MI or myocardial infarction is either the demand is increased or blood supply is reduced. Demand is increased by exertion, any form of exertion, aggravated by any increased demand like exercise or maybe a mental exertion, as well as cold temperature outside, because cold temperature, coronary vasoconstriction. So blood supply is reduced due to the cold temperature. So maximum peak of myocardial infarction occur during the winter season. This explain it to be a winter season. While it may or may not be decreased by nitrate or rest, if it is decreased by nitrate or rest, that will go more in favor of a anginal pain. Then the duration of the pain for definition of the ST elevation MI is always more than 30 minutes. More than 30 minutes. So this is the most common symptom of the ST elevation MI. Other symptoms which can be present are other symptoms. These include vomiting. So it can be confused with some GI disorder. So the reason for the vomiting is this is especially seen in cases of inferior wall MI. This is due to the activation of the vagal reflex as a part of. So this is due to the activation of vagal reflex as a part of reflex which is known as gerish reflex. Reflex. So, which include bradycardia, hypotension, and decreased breathing. And it is especially common in cases of inferior wall MI. The other symptoms include the symptom of dyspnea. Dyspnea is because of the heart failure, which is usually common in cases of a left ventricle MI, that is anterior wall myocardial infarction. Patient can have syncope, and syncope is basically due to decreased cardiac output, which can be because of heart failure, which can be because of some arrhythmias which can be triggered, or it could be because of the AV blocks. So decreased cardiac output due to either heart failure or due to arrhythmias, which can occur in myocardial infarction. While the other symptom include the symptom of indigestion. Surprisingly, it can also present as psychosis, restlessness, especially in elderly. So always do a ECG in these patients. And if there is a pulmonary edema, patient can have cough with pink frothy sputum. Pink frothy sputum. So these are the other symptoms which can be present in cases of the myocardial infarction. There can be a condition where the pain is not present because of autonomic dysfunction. So we look for angina equivalent symptoms. Means ki they will suggest that angina or the MI is present. So this is known as a painless MI. So if painless MI, there is no chest pain in the patient. This painless MI is especially seen in elderly, elderly, as well as in patients with diabetes. So always look for the anginal equivalent symptoms. Angina equivalent symptoms has to be looked for. So what are these angina equivalent symptoms? This will be very important word, unexplained. Unexplained sweating. Why unexplained sweating? Like a patient of diabetes comes at around 3 o'clock in the morning, 3 a.m. So it could be a low sugars. Hypoglycemia can be reason for a unexplained sweating. So for sweating. So we have to check for the sugars. Sugars are okay. That we will ascribe it to be a unexplained, could be a myocardial infarction symptom, or unexplained dyspnea, or patient has a sense of impending doom. Sense of impending doom. So these will be suggestive of angina equivalent symptoms in cases of a painless MI. Now come to the physical examination.